morning, good evening, good afternoon, whatever you are. So, as you can see from the title of the video that I named it, this is to talk about our national health service, NHS, if you want to call it like this. Uh, I had some questions from American friends, people that I know, but it was mainly Americans that made me this, posed me this question. So I decided to make this video just to get rid of some of the misconceptions and strange ideas, I don't know why, that Americans have about Europeans' NHSs and health services. First of all, the Portuguese National Health Service, sorry, I'm with the word center in my head today, don't know why. It is very similar to the Spanish one, to the French, and to the Czech. Okay, very, very similar indeed. Because basically all of our NHSs they were born in the same way. The British NHS had a big influence, of course. Was one of the first, but not the first, unlike the British like to think. But but the way it works, the way that it finances itself, it was influenced by that NHS. Let's be clear about it. Okay. What I'm trying to say is that when you cannot look for a unique source of an NHS in any country because it has to do with the history of the country. It has to do with a lot of factors that you cannot just point and say, look, it was there. You understand? It's impossible. Don't try to do it. I tried it. It didn't work. For example, the roots of our NHS go back to one of our queens that decided that the poor also needed access to doctors, to asylums, okay, and with the help of the Catholic Church, that is still a part of a lot of services here in Portugal. It is. It provides a lot of wide range of services that go from taking care of the elderly, taking care of children, orphans, widows or people or women that have to leave home because of mistreatment, okay, for battery, for all of that crap that we know that exists in any bloody society. So the church here works in conjunction with the state, okay, and the services that the church provides, are under the direct supervision of the state. The state is the one that calls the shots. Let's call it like this. Okay. Now, let's start from the way that this works around here. When you are working, meaning when you are contributing to society, uh, a part of your salary goes to the NHS and to the social services. Sorry. And a part of what your employer pays you, he also has to put in the NHS. So, the first misconception that I want to clear up is this: Americans, our NHS is not free. It's affordable, it's humane, but it is not free. Every country has a different rate that comes out of your salary every month, every pay that goes into the NHS. And a part of the total budget of the state also goes into the NHS to pay for doctors, for nurses, for medicine, for hospitals, health centers, for all of that. Okay. The second misconception that I'm going to clear up is this: there is private health service in Portugal, just like in anywhere else in Europe. The difference here is, for example, Right now, an average appointment in a private doctor is around 50 to 60 euros, at least in the place where I work. Sorry, where I live. Now, I pay upfront those 50 euros. In my case, it's 50 euros, okay, to the doctor. When I need some things, for example, when I need instead of waiting at least 1 week, at least a week, it's the average waiting time. I will go back to that and explain why. Instead of waiting, for example, a week for an appointment at the local health center, a non-urgent MP, medical practitioner, uh, okay, I'm just trying to use terms that you will be able to understand. Okay? Instead of a doctor's appointment, for example, I need something quickly now. I need to go do some blood works, no analysis. I need to do this or that. Or, for example, an appointment for your glasses if you use them like I do. Okay. Well, and look, whatever you need, okay, whatever you need, you can go. But then I can take, if you are working, I can take that. If you are not working, you can take that money that you spent in the doctor and file it in with your taxes for a part of that to be returned to you by the state. If you are working, you send it to your health provider so that you can get back a part also of what the total that you spend, and that is all in law. That is all written. I can go online. I can see it. I can do anything. I can understand why I'm paying this or that. Right now, I have an app. In this computer, I still have not installed it. I need to install it. Maybe in this weekend, I must not forget. I have an app. I enter in that app and I can see all of the exams that I made. I can download them. I can print them out if I need to. But these days, you don't use much paper. Uh, I can make an appointment at a health center. I can do the things that you would do going into the health center directly, and it's quite convenient. If you don't know this, we have a digital key that is unique to each citizen. That is verified through many safeguards. There's a lot of. Let's just say it's not easy to hack them, uh, because everything is you can hack anything. Okay, believe me, I've been working with computers since I was 7 years old, so I know it. Okay, anything can be hackable if they want to do it. Okay? As I was saying, sorry, lost a bit of the train of thought. Our healthcare is indeed you pay for it. You pay for it in your taxes. Right now, for example, if you go on your own to the hospital, you will pay administrative taxes that in my price in my salary price range, I pay around 17 or 16 euros, something like that. If I go through the new service that they are implementing, SNES 24, I will pay nothing. And even when you pay, I just pay those administrative taxes. For example, remember when I told you that I wasn't feeling very well, and my older brother, decided, look, no more jokes. It's time for you to go to the hospital. And there wasn't really time to phone in through the system. It doesn't take less than 20 minutes, 30 minutes to be attended. Let's call it like this. But of course, remember this. Imagine this is an emergency situation. You call the number for the emergency services, and they work just the same. Okay, this is just you. You're not feeling very well. It's the weekend or something, and you need to go to the hospital. And you phone to that service. You are attended. Let's call it like this by a nurse. The nurse listens to you, asks you all of your details, verifies everything, and then advises you on what you should do. And if the nurse decides to go directly to the hospital, she will tell you you can go directly to the hospital or health center, whatever. The one in the area of where you are living is this one. Just go there. And then they, in that service, they email or phone, but usually I think they do all the communications by via email. They email the hospital and say, this person is going there. Okay? But as I was saying, in that case that I did not go to the process, let's call it like this, because it was an emergency, I indeed had to pay. But I can pick up that payment that I made and I can put it in my taxes, and most of it will be returned to me because I'm already paying taxes for having the service. This is the logic behind it. And also the logic behind this is this. A person that has more money, okay, pays into the service. Someone that has no money, no income, like for example the older people, the retirees, some of them are receiving a minimum pension. A lot of older people here are receiving a minimum pension because they are from a time where the salaries were lower, the discounts were lower also, and many of them also did not make any discounts, whatever. They have a minimum pension. But in return, look, they get the health services practically either completely free or with a very, very symbolic method. Okay, continue. Now, this service is going through a lot of changes. Let's not beat around the bush. And I'm going to talk about my country. They have been uh, they have been trying to solve a lot of issues that we have, and the issues come from, for example, the people that insist of not going, for example, first to the local health center to make an appointment or whatever, because the waiting times are very long. So they are also hiring more doctors, more nurses. They are trying, but uh, let me be honest with you. I think people don't understand that these things take time, and I know it's hard. And look, I know it's hard, and sometimes people tend to complain, but in my view, they're complaining with their tummy full because now, again, with my last, let's call it trip to the hospital, when I really had to go there to be medicated, to be treated because I wasn't feeling well, I went through the app. I arrived at a hospital. Less than 10 minutes later, I was in triage with a nurse. She was talking with me. She was asking me. I had some papers that I brought from another doctor of labor health, because I won't go into details, but this is how it started with a mandatory appointment with a doctor that monitors the state of the workers of a company or a public service. She basically told me go immediately to the hospital. Basically, this is what she told me. But please, no worries. I'm better, okay? All controlled. And I just presented the papers. She looked at me. She examined me visually. She saw if I needed anything. Went into a waiting room. Sat down. Another less than a quarter of an hour. Less than 15 minutes later, I was called in. I went to see a doctor. He talked with me. He examined me. He saw the paperwork that I brought. And he told me to wait a while again. I waited another 5 minutes. 5 minutes later, I was going into a treatment room. I was getting my blood drawn, my tension, blood blood pressure, blood pressure, yes, blood pressure measured, a lot of stuff. Immediately, they gave me a shot to normalize my situation for my problems. Then went into the waiting room again, and then they called me into the treatment room. This was a matter of, I don't know, a quarter of all. Went into the treatment room. I sat down. They gave me the medicine. A doctor came and examined me. She looked into my records. She explained to me in detail what was happening to me personally. This is very important. She sat down near me. She was, if you don't understand how this works, it's a large treatment room that can hold about, I don't know, 50 people perhaps, something like this. And there are they have mobile units of treatment. Okay, and you are constantly monitored by nurses that are looking over you, seeing how things are progressing. Okay, I got treated. When I left, I went to talk again with the doctor. Again, she examined me. She gave me my paperwork, and off I went with a prescription to pick up at the pharmacy. I went into the pharmacy, and three different, three or four different medicines, pills and all of that. No, I'm lying. Sorry. I got for free the doses that I needed at the hospital for two of those medicines that I had to take, and I went to pick up two different medicines in the what's called in the sorry in the oh God sorry bit tired. It's a lot. It's really hot here. I went to pick up at the pharmacy, and it was around €5 and something like that for two different medicine prescription pills. You understand? Okay, that was it. This was Saturday. This was Friday. Sorry, Saturday and Sunday. I continued with the treatment that I already knew. As I said, she explained everything to me. She told me how to take the pills, all of that. And when I went to the pharmacy, the pharmacist repeated again. Okay, Monday morning, Uh, I went into the doctor's office, to the the local health center. I showed them the documents. They saw that this was an emergency situation, and they saw how I was, examined me by a nurse, and I had immediately they put me online. And Monday I had an appointment, and in the other Monday I had another appointment with the doctor. Monday, the next Monday, I went into the doctor. And the nurse looked at my paperwork, that it's all online, okay, all in files, and they can also have it physically, but there is no need of wasting paper on these things. She saw that I needed to take two shots, vaccines that were in fault. In this case, I think it was the measles and tetanus. I don't know how you say it in English. And I took my vaccines, more blood work, yes. Uh, I went into bloody vampire again, okay. Then I went to the doctor. We spoke. She examined me. She saw my entire history. Okay. She told me exactly how my treatment would be, with what frequency I would have to have appointments, and everything was good. Oh, by the way, I did not pay 1 cent for all of this stuff. Nothing. What you usually pay is the prescription drugs. Okay, this you pay. You pay a part. But to be honest, it's affordable because you pay according to what you have. And if you have no money, you won't pay. There is a principle that no healthcare is a fundamental right. The fundamental rights cannot be breached. So when the person does not have money, they won't pay. And now you can tell what a lot of parasites are certainly hiding their wealth or whatever, or not having any visible wealth, and they are abusing the system. Well, of course there are. But as someone that pays taxes, as someone that contributes to the system, I'll tell you this. It's very hard because to work in anything, even if you are only, like we say, we know we have two ways of work. A contract, even if it's 3 months, 6 months, 1 year, 2 years, 3 years, whatever contract, or what we call prestação de serviços. This means providing services, meaning someone hiring you to do something. And maybe they are paying you by the day, okay, maybe they are paying you by the hour, whatever. For all of that, you need to be registered in the tax services, and the person that is hiring you to make the service has to say, let's call it like this, to the tax services, I paid, I don't know, I paid 150 euros to Mr. Whatever to fix my pipes or fix the boiler or whatever. And you, in your yearly income declaration, you will put all that you earn. You will have to provide. And the state will cross data. They will cross data, for example, your bank reports, all of that. So it's not very easy. This is the first thing that I have to tell. And the second thing is this: I rather that a person that is old or a person that is poor, more poor than me, that sometimes cannot even eat, I rather that that person has health care. If Americans like to talk about being a Christian, well, this part of our constitution is completely based on Christianity. Completely. It's better for those people to have health care than to have people working sick, people dying too early, people dragging themselves in the streets ill. You want to know what happens to a person that, for example, has mental issues and wanders around in the streets? The police has the duty of arresting, let's call it like it's not arrest, detain that person and send that person to the system. And if the person is not in conditions of being in the street, if the person does not have in the street being in society, let's call it like this. If the person cannot does not have relatives that can take care of them, then they go into an institution. And yes, sometimes things take time. Yes, it's not perfect, but the issue here is that it's there, that health support is there. And you don't have that. And then you tell me, oh, but our healthcare is superior. No, it's not. Even our humble healthcare system has more quality doctors, more quality hospitals than much of your territory. We have top doctors, and they are national, and they don't work, and they do not just work here, and they are teaching in universities, and they are taking in young doctors and teaching them. There is this entire tradition of knowledge. There is all of this, and not just here. Spain, in France, in Germany, in the UK. Let's see if they can hold on to their in NHS in Germany. And it's not free. And then Americans call this socialism. They call common sense socialism. Imagine this. You are an American citizen, okay? You are working, you are paying your taxes, and you have a national health center. That national health center has hospitals. There are insurance companies. We have them here too, okay? Here to work in almost anything except perhaps writing books, you need insurance. You have to have an insurance of some kind, and you pay for it. It's affordable. It's affordable, but you pay for it. Okay. But when there's an issue, they are there to pay, either you or your family. But it's not them that blindly decide the rates. It's not them that. It's not the pharmaceutical companies. It's not the private clinic, private doctors, and all of that private insurance that decides what is paid. It's the state, it's the assembly, the parliament. They listen to the pharmaceutical companies, they listen to the insurance companies, they listen to everyone. And then they decide what is the rate that the state is going to pay them for providing services. And then all of those private companies, they work in conjunction with the state. But you have that hand of the state that would not allow something like, for example, it was a joke in Family Guy where Joe, they asked the, and if you don't remember this episode, it was very telling, and this happened in real life. It happens every day in the United States when Joe could have either an expensive surgery that would allow him to walk again, or a cheap wheelchair. And the company says, oh, give them the wheelchair. This would not happen here. You want to know why? Because that insurance company would be committing a crime. Because the principle is this: the private is only there, in this case the insurance company, to provide either the exact same service that the state is providing or a better service. This is why when the private companies here are providing public services, for example, transportation, this is an example or something like that, they are compelled by law to either provide the same service at relatively the same price. We all know prices change according to the economy. That is natural. That is normal. That is capitalistic. They can either provide them at the same service and the quality, but preferentially, when the government does that, is to create more competition between companies and also to provide better services to the citizens. This means that, for example, in a country like France, like Germany, like Portugal, like Spain, or whatever, if a company did what the other companies are doing in the US, in the UK, those companies won't be working. The government would have all that is necessary to say, you are providing a shit work. You are doing absolutely what? Where is the money that came in from the EU to refurbish your water treatment plants and that you told us that you used to do that? Where is it? Okay, you're out of the business. And then the state could simply tell them to F off and either nationalize that service and provide the service the government itself, or give it to another company that would do the job. Because the question here is not having private companies working with the state. That has always happened. Always. In the time the Portuguese were sailing across the seas and establishing trading companies everywhere, the traders, most of them, were private people. they got permission from the King of Portugal to do that, to go, for example, to a territory that we have recently discovered, and we mainly, except in Brazil, where we did an actual settlement in another selected places, our purpose was to do trade. We, we didn't want dominance. We wanted dominance of trade, of wealth. Simple as this. That they would go there, and then you would have private houses of traders, companies. We can call them companies, exploring the, for example, the space trade in this island or this or that. And the state would provide, for example, for military protection, for transportation in the ships, and it would receive a part of their wealth. And then they would take that wealth and use it. And up until the 1700s, they in fact used it very well. Okay, they built roads, they built castles, convents, hospitals, okay, schools, a lot of stuff. But then came that, and up until the independence of Brazil and the Napoleonic Wars and all of that, there was a lot of chaos, confusion, and corruption in the country. Okay, but that is a subject for a long stream, long video. But what I'm trying to point out to the Americans is this: this works, and in my view, and this is my opinion, of course, my personal opinion, the USA would benefit from a service similar to the one that we have here, of a based income payment. This would mean that, for example, Joe, that I don't know, got receives $1,000 a month, would pay either a reduced tax on medical services. Then, for example, Michael, that earns 20,000 euros, $20,000 a month, or even if Michael had the services income superior to a determined threshold, then he would have to pay the full price of all of it. This would mean that the government would have bigger control over pharma companies, over insurance companies, over a plethora of services that would turn the United States into a better place, into a safer place. Because look, I told this story. We'll tell you again. I even wrote a comment about this at least 3 times now in the comments of videos. Some time ago, before COVID, I was at the beach. No, and I was talking with the lifeguards because I knew them. They were from my hometown. We were just chatting, okay, in the beach, whatever. And then we saw a lady that we then saw her talking with her and her husband and the children. I think they were Americans, and I looked at her and I knew, and my friend, the lifeguard, he also looked at me and he knew she was having heat stroke. Okay, I am also very prone to heat stroke. I am very, very pale. I have issues with the sun, and I have to be extremely careful with heat stroke. Okay, I know the symptoms, and she was having a heat stroke. He looked at her. We put her in the shade. Did his things. And then he looked at the husband and all of that, and he was talking in English, okay? And he said, "Look, she needs to go to the hospital. We need to call an ambulance." And they were, "Oh no, don't call an ambulance," and this and that, because they were terrified. Because apparently, from wherever they came, a bloody hospital trip in the ambulance was around $2,000 or some shit like this. I don't really remember how much they were talking about. And we were explaining to them, look, no, you don't need to be worried. Stop that. You won't pay that. And they were going on, and my friend, he did what is done here, because around here they don't. f around. He called the police, and usually during summertime the police is constantly going up and down the beaches because there's an increase in crime, of course. It's natural. And the police looked at him and said, "No, call the ambulance." The ambulance arrived. They took her and the husband and the kids. They went all off to the hospital. Next day, I talked with the husband. And then, first of all, in health terms, in health wise, sorry, what happened to her? The same thing that also happens to me. And it had recently it happened to me 3 times in the recent years. Okay, it happens. It's normal. Sometimes it's a bit lighter, and I don't need to go to the hospital. But one of the times I really had to go to the hospital because I was a dumbass. But she got to the hospital. She was examined. They took her blood to see if she had any issues. They made a complete history of her health problems. They made her the usual questions. Do you what chronic diseases you have and this and that. They took her blood. Okay, they saw her vitals. They put her in a treatment room. They hydrated her. They gave him whatever meds they want, and they left. And she left with a prescription drug to pick up at the pharmacy. She could pick it up in any pharmacy. Okay, and she picked it up. I don't know how much that was because I didn't ask them, but it was probably, if it's the drugs that I think they gave her, it would be around €4 or something. Okay, and total tab, €17 or something like that. They paid the average middle high income for the treatment. They did not pay for the ambulance because it was an emergency situation, and he was completely flabbergasted. So, Americans, if you come to Portugal and you have a health problem, don't be afraid to call an ambulance. First of all, they will treat you even if you don't have the money. Okay? Even if you don't have the money, they will treat you. They will charge you later, but they will treat you. And secondly, it will be affordable. I don't think you will pay more than 25, 20 euros for a hospital a hospital appointment. And you will certainly will not pay €2,000 for a bloody ambulance. That is monstrous. Because I see people in the USA, no, and I'm not talking about movies. I'm talking about the things, for example, like those police service or whatever, and talking with people and listening to them. And people are afraid of going to a doctor. And this is monstrous. This is this is obscene. And to a country that calls itself so Christian, why? Because most of the poor people are black or some shit like that? Who cares? If you cut them, they're all going to bloody bleed like you. And if you give everyone that is poor, okay, if you give them affordable healthcare, those people will be more productive citizens of your society. Why? You are afraid of cutting the profits of the insurance companies and the pharma companies that are financing your governments. Well, illegalize it. Around here, parties cannot receive donations. Here, if you want to participate in a party, you are a volunteer, and the parliament decides how much is allocated to each party as, let's call it, expenses. And those expenses are always limited because they go, for example, they promote themselves personally. They go from city to city. They go to events. They explain their ideas. Okay, They go on the streets, they talk with people, they go on TV for debates with other candidates, all of that. It's a normal process. But donations, that is a crime. Here, a person can, here a party can be illegalized, okay, and the people can get arrested for that shit. Why? Because imagine this: big pharma pays a nice donation to a party for them to abolish this and that. That party, when it arrives at the parliament, when it's ruling, it's completely biased. It's bought by that company. And that is not the purpose of parliament. Any parliament, and I'm talking about the democratic elected parliament, okay, whatever form it assumes, okay, I'm not going to go into the discussion of PR or non-PR. I'm not even talking about that. I'm talking about the democratic elected parliament. That parliament is there not to rule the citizens. It's there to serve the citizens. They receive a salary and they have a mission, and that is to make the state function and preferentially make it better, make it more effective, make it make it less what's called less incumbent. It has a purpose, and in healthcare, it's the same. And right now, we are having some issues, of course, but this is not the first time that this situation has happened. For example, it happened in the 80s. I remember that. Then it started to work correctly. And now, in the early 2000, 2010, 2012, 2013, it was not working correctly. So right now, these changes are needed. Even if we don't like it, are needed. And besides that, the Portuguese, like the Germans, the national pastime is to complain. Sorry, it's the truth. I'm not like that, but there are some people that like to complain. Okay, I was there, for example, when I was there in the hospital. There was some guy that was just there for some bloody thing that he could have take care of in the health center, and he was complaining and complaining and complaining because he was there waiting for so much time. And why? He knows how these things go. I have no issues. For example, in the last time that I went there, they wanted to put me. They have three categories of armband. It's a kind of a hard paper saying that they put on your wrist the minute that you go to triage to decide if your case is more or less urgent. It goes from the green, let's see if I remember, green, yellow, and red. And in the first occasion that they told me immediately to go to the hospital, the girl said, uh, "How are you? Can you wait for 10 minutes for a quarter of an hour?" And she wanted to put me a red one, and that would mean it would take 5 minutes, 10 minutes at top. And I told her no. Put me the put put my the yellow one. I can take it. And I went back, sat down in the waiting room, and I waited. Why? Because there were older people there that needed assistance. There were, and one saying, children and adults are separated in the emergency rooms. Okay, this is an important one. But and children is people up until 18 years old, also important. But continue. And look, I just sat down and I waited because I had full conscience. And this is a hospital, an emergency room. Okay, the people arriving that are seriously injured, people that accidents, all of that. It's all passing through that. Even we're in a waiting room. Some people don't pass where we are, but some pass. Okay, there are people in stretchers, there are people in wheelchairs, and I decided to wait. Why? Because you have to be patient with this. And I know it sometimes it's hard, and I know sometimes there is failures in the system. and that people die without justification, but it happens. It's normal. We are talking about human factors. We are not talking about machines. Okay, but I hope that you will now understand that the myth that Europeans have free healthcare, and I will do another video talking about the vacations and contracts and all of that. Going to do a video about that too. But I hope, especially you Americans, that you have this myth that those lazy Europeans have free healthcare. That is bullshit. That is your politicians. They tell you that little story, like they tell you other stories, in order to control you. Because this way, you will be afraid of asking for the things that we asked and that we bled. Okay, my great grandfather, he was in the barricades for the health center, for the healthcare too, and his fight contributed for things like, for example, even during the dictatorship, when he complained, let's call it like this, even during the dictatorship, people had healthcare, free healthcare, also, about the same system that we have now. So, and these things, they don't just end up in your plate. You have to fight back against oligarchs. And you don't need violence. Look, you don't need violence. If some bloody oligarch, bloody rich person, starts to see, for example, thousands of people peacefully marching in the streets asking for their rights, they are not going to like it. They are going to be afraid. And they know that it will be very expensive to have repressive policies. Repressive policies do not work. One day or another, all tyrants fall. All of them. All tyrants fall. All repressive systems die out. You know why China still is there? The USSR died and now it's that mutant saying ruled by Putin. You know why is that? Why is that? Because in China, they always gave a limited freedom to their citizens. Always. Look, China is not perfect. It's not. It's not perfect. No, not at all. Is there repression? Yes, there is. And bloody hard one. But there is a limited freedom that the government gives to their citizens. Why does the government does that? To keep them happy, to keep them tame. And if you in the USA start with this repression bullshit, like ICE, do you think it will take very long for someone to snap and start fighting back with violence? And violence leads to nothing. Look, if you are listening to me, violence solves nothing. Violence is like, for example, someone screams at you, you snap, you give him a slap, the person shuts up. The person shuts up in that moment. As soon as you turn your back, the person will slap you back even harder, or slap you to the floor. It doesn't work. But if you go to that person and you try to reason with them, or try to show yourself stronger than that person, assert power in whatever way. I was talking about China. China does that to their citizens. They assert power. That person will calm down, either by fear or by understanding that their screams will hurt, that someone is going to try to do something about it. So, again, this video has gone long enough. Americans, there is no free healthcare in Europe. We pay for it. We pay for each and every service that we have. We contribute to each and every system that we have. And if you want to call this socialism, well, I'm not a left winger, but according to you, I would be a socialist. I am a steady defender of of the citizens' rights being defended by the state and having the right to bear weapons or bear arms or whatever the fuck you call it. I don't think that is very important when we are talking about, for example, that's another one. Just to wrap it up, I can have a hunting rifle and a gun to defend myself, but I cannot have those if I'm a lunatic, if I have a criminal record or whatever. No, and this is how it has to be. Like I told in some other videos of mine, I hunted when I was a kid. I just didn't like it. No, I don't like to kill animals. I would kill an animal to feed myself, but if I can go to the butcher shop and get my meat from there, why the fuck would I be killing an animal? I like to hunt the animals, with what? With my notepad to draw it, or to have that pleasure of being near the animal. Sometimes I even carry my bow. Like that sensation of being able to approach an animal without the animal seeing you. Or with my phone to take some pictures. But I don't like weapons. But if I wanted today, today no, because here it's Saturday, so the services are closed. I would go to the weapon shop or whatever. I would tell them, look, I want to buy a hunting rifle. They would tell me the paperwork that I needed to get. And in a matter of weeks, I would have my permit and I could have my weapon. If you come down here, for example, to South Portugal, most people have a hunting rifle at home, especially in the rural areas. I'm not telling you that in the biggest city, everyone has a hunting rifle in their homes. Of course not. But if you go to a local rural community, everyone has a hunting rifle, especially when you live in an isolated house or whatever. And that hunting rifle is not just for hunting; it's also for defending yourself. And as for the weapon, the personal defense weapon, you just have to go. For example, uh, in my work that I was doing, I felt the need to have a weapon, and I had one. When I was no longer doing that work, I didn't need the weapon, sold the weapon, and I did not renew the license. But you, for example, if you come here and you feel insecure without having a gun at your house, you can apply for one, and it's not that very hard. But we don't give, like I saw in the documentary, so it was personal. I think it was in Texas that a guy went to a shop to buy a bottle of bourbon or whatever, and he went to the shop next to it, and he got a gun or even a semi-automatic rifles. What the fuck is that? It's lunacy, complete lunacy. But but let me, and I'm prolonging this, but let's end my reasoning. Look, it's also lunacy how, for example, ICE units are armed, how some of your police is armed. It's all complete lunacy. Okay, your police force approaches policing like some kind of military operation. Okay, they don't work with the communities, and I'm telling, and look, majority of cases, majority. I'm not trying to generalize because I know there is different situations in some parts of the country. But I know this also. Don't bother to comment that because I know it. I'm talking about the general sense. Okay, but you have these situations where the police they act like, I don't know, like an invading force. And if you happen to be brown or black, man, you're fucked. You are, because you will find. Look, I'm not, like, again, I'm not generalizing. Of course, not all white cops are racist. Of course not. It is ridiculous. And you have black cops, and you have Hispanic and Asian cops. No, look, that's not the point. But it's that bias, okay? That look that dumbfounds me. In here, you have regular cops who stops by cops. Sometimes they do operations where they for monitoring alcohol consumption, for monitoring illegal vehicles, for monitoring illegal aliens, illegal persons in the country. All of that. They do operations for drug tests, for whatever. They do operations in key spots. They go there. They stop the traffic in that area. They siphon to all the people. Okay. Sometimes it's to siphon lorries, and trailers, for example, awful trailers. Okay. Trucks and all of that. But it's not the same. Look, a cop arrives. Look, you want to know how the usual dialogue is? A cop arrives next to your door. He says, "Good morning. I need you to give me this and this and that. Usually, it's your driver's license, your ID card, or passport if you're a foreigner. Because this is another one. You cannot drive without your documents here. Even in the street, you should always have your identity card with you. And you perhaps you will consider this fascism. It's not. It's the law. You have to identify yourselves. Cops are not there to be your friends. They are there to monitor you, monitor your behavior and what is happening there. And you have to respect them, and they have to respect you. But as I was saying, when he asks for the documents of the car, then, for example, if he considers that it's necessary for seeing if you are driving under the influence or whatever, you blow in the machine. If it's all right, it's all right. Okay, and off you go. Hey, thank you, and off you go. Not hard. Around here, you can approach a cop. For example, you're in a big city. You don't know where something going to. You go to a cop. You ask him, "Excuse me, officer. Can you please help me? How, I need to go to this place. Can you tell me where this is?" Or and the cop will say, "Look, I don't know, but going to this coffee shop. I'm not. For example, it happens. It has happened to me. Going to this coffee shop and ask the gentleman there, and he will know. He certainly knows where to go. Oh, come with me. I'll tell you where it is." All of this experience started when I was a kid, for example, and my mother was often in the hospital, and we we were. It was me, my mom. I was around, I don't know, 6 years old or something like that when I started to go there, and my older brother that is 6 years my senior, and I have another brother, but okay, but he's 6 years my senior. And my mother, she knew this was in Lisbon, and she knew more or less where the hospital was, but she was a bit lost. Didn't know if basically she didn't know if she should go in one direction or another direction. And there was a police officer doing his job. She went to the office and she explained, and the police officer said something like, "No, you are with the children. I will take you there." And the police officer went out of his way to take my mother, me and my brother directly to the place, to the street. Look, see, just go out. Cops went to my school when I was a kid. You are taught if you are in distress, if you have an issue, to go talk to a cop. Can you do that in the United States? Okay, you're white, maybe you can. Can you do that if you are black? If you are Hispanic? If you can do that, then you are in a good place. If you tell me you can't, you know where you are. And let's end this in. Okay, I hope that this video has been at least uh, informative, and that you are able to understand more or less how these things work. Uh, feel free to ask any questions, okay, in the comment sections below. I'm sorry if I'm sometimes take a little while to answer, but I sometimes get lost in other stuff. And I forget to answer people. Okay, it's not on purpose at all. Well, thank you very much for listening to me. I hope that you are all safe, and I hope to see you next time.